I'm Dr. Matthew Halpert, founder and CEO of Immunocine. I've spent most of my life in the space of cancer and cancer immunotherapy, and today I'm here to answer some of your questions. Go ahead and click on the different chapters below to get to your specific question, and let's discuss. We want to thank you for taking this time to ask these great questions and to do this level of due diligence. The next thing we want to do is talk about the actual enrollment process and the logistics of becoming a patient with Immunocine. While we want to help as many patients as possible, it's important to know that Immunocine is not a walk-in clinic. And for any patient to be approved for treatment, they must go through a complimentary medical review so that our team can gain better insight and understanding to each cancer patient. At a minimum, this will include recent blood work, scans and reports, and an oncological summary so that we can map out the best path forward for a patient. Our coordinators will be able to help you upload various files and engage with the medical team during the review process. Once approved, we will let you know and move forward to scheduling and seeing you in Cancun. After we get through a preliminary review and move towards eligibility, we have many previous patients that are delighted to speak with you and share their perspective on their treatment with Immunocine. During the medical evaluation, our team will look at your questionnaire and all of the files you've been able to upload. Specifically, they're going to look to ensure safety and potential efficacy of our treatment for your specific cancer in your exact situation. This takes roughly 10 days to complete, and as soon as we get through that, we'll be in touch. There are a few overarching factors that may make a patient a more suitable candidate for the Immunocine treatment. This will include having a solid tumor that is able to be reached and biopsied, and having a stable immune system that is still functioning correctly. You also need to be able to travel to Cancun and handle a 6-week protocol. And though a bit of a touchy subject, we have to talk about the prognosis. This is a process, an immune response, and it does require a certain amount of time to ramp up and do its job effectively. Therefore, we do prioritize patients that have a prognosis of at least 4 months so that their bodies have enough time to do a job. Absolutely. We have multiple coordinators that are happy to assist you in coordinating your travel to Cancun. Once in Cancun, we will handle all transportation to and from various medical appointments and to and from the airport to assist you in your travel. If you feel that you may benefit from having a dedicated nurse with you while in Cancun, Immunocine is happy to help orchestrate and coordinate that. However, it is not part of our normal cost or treatment process and would be extra in this situation. If you are looking to add supplements, drugs, or other alternative treatments, we simply ask that you talk to our medical team first so that we make sure you aren't doing anything to counteract the Immunocine program. With that said, this treatment is natural and a normal part of your biological process and is unlikely to prohibit you from adding other treatment modalities to your process. The Immunocine protocol is going through numerous clinical trials right now. If you'd like to learn more about them, use the NCT identifiers below, uploaded in the clinicaltrials.gov website to gain more information. And if you have a cancer that is eligible for one of the trials utilizing the Immunocine protocol, we will always first direct you to those teams to determine your eligibility there first. While in Cancun, you will have as much medical supervision as is needed, and patients are often surprised with how much interaction they actually have with our doctors. Whether that's the oncology team, radiology team, or another specialist, we will ensure your safety and proper medical treatment throughout. We also are working with all 3 full-service private hospitals in the area if needed. Patients are often surprised with how often they hear from us after completing the Immunocine treatment. Whether it be from our oncological nurses, doctors, or other coordinators, we continue to check in on you to engage about symptoms, ongoing treatment options, and other ways Immunocine can help a patient fight back against their cancer and truly get back to complete health. We hope we've been able to answer several of your questions here, but we pride ourselves in being transparent and responsive, and if you have more questions that weren't properly or completely addressed, please do not hesitate to reach out to us.